Hi, my name is Tina, and today I have chosen professional image as my leadership conference topic. I chose this topic because I find it interesting that nurses in Florida wear every color of the rainbow outside of the traditional white uniform, so this was an area I kind of wanted to explore a little bit further. The article I reviewed for this project was A Uniform Approach to Nursing Attire and was written by Carolina Fogel and Paula Reams. This article highlighted the author's combined views of the professional image of nursing over the decades and the way that nurses are viewed in professional uniforms. This article also discussed uniform trends, professional attire, and nursing image. It focuses on the influences of other generations and provides evidence aside from the traditional white uniform that most of us only see at nursing graduation times. Also, we'll be discussing trends in the 21st century and how the professional nursing appearance does matter in the eyes of patients that are entrusted to our care. Take in mind, pediatrics was not a consideration for this study, so it was not evaluated. Let's start with the historical perspective. Back in the early 1900s, the traditional female nurse was portrayed wearing an all-white dress uniform with white conveying two messages. The first one was identified with being a servant, and the second was considered to be present in a clean and professional manner with a pure image. And this study showed that most people from that time era do prefer the all-white nursing uniform. Over time, the traditional white nursing uniform eventually fell out of favor as the nursing role began to require more physical endurance and as more men entered the profession. Nurses needed a uniform that was more durable and functional. So by the time around the 1980s, the scrub-type uniform, which was usually a pant-top combination that had previously been worn by only the operating room staff, met those needs and became the preferred style of the nursing uniform. And again, this was in part because more men were entering the field of nursing. So a more unisex style was desired at that time. Since that time, the nursing uniform has continued to evolve in both style and design, with the marketing geared toward the wearer's individual preference rather than a standard all-white, crisp look of a nurse. Modern day trends in 2016. Some modern day trends in professional attire is imprinted with cartoon characters or the logos of popular sports teams. Some are mismatched color or print combinations, and others are polo shirt-type uniform tops that identify staff from specific nursing units. Some uniforms appear pressed and crisp, while others look as though they've never seen an iron or have been washed way too many times. And sometimes only a name tag that's laminated that says RN consistently distinguishes the nurse from other healthcare professionals. Surprisingly, looking at the evidence does show differences in what most people think about uniform differences. So what is the right choice? Is it an all-white uniform? Is it wearing prints? Is it wearing solids? Some healthcare institutions have returned to the all-white nursing uniform. But again, this has presented numerous challenges. For example, the white uniforms do show soiling more easily than darker uniforms, and they must be laundered more frequently. Another barrier to moving back to an all-white uniform is staff resistance. Let's face it, who wants to wear that white uniform again? Men may be turned off by the nursing uniforms as they perceive them as feminine in style, and particularly print uniforms. So it goes without saying, but unisex styles should be considered when making uniform decisions. However, not enough research has been done on the idea of prints versus color scrubs that patients consider professional and approachable. Lastly, let's face it, appearances do matter. Although the old saying, you can't judge a book by its cover, is true in many forms, the research on nursing uniforms points to a different conclusion, that many patients and families quickly do form opinions about the way their nurses are based on their nurse's appearance. For continued success, leaders must understand and implement evidence-based care, which may include changing nursing uniforms to foster the trust in the nurse-to-patient relationship. This concludes my video, and thank you for watching.